Hi, good afternoon. This is Dr. Afflalo. I'm here to answer questions. Today, our topic is going to be about acute liver failure. So, Dr. T, how
Well,
you doing?
Dr. Afflalo, we're so excited that we have this time once a month with you where we get to ask questions. Now, in the community, a lot of us have health insurance, but guess what? So many of us don't want to go to the doctor because for fear of bad news. And so we'll hear from Mama and them and everybody else to tell us what is going on or what we think is going on. And so we really this show is about being able to be in a safe space to ask questions, and then also realize that IWC primary care is there for you and in our community doing wonderful things. And as your topic today, acute liver failure. Now, I'm just going to be real with you, Dr. Follow. I thought that only folks that have acute liver failure was drunks that drunk too much, and what they say, they done killed their liver through the drinking. But I'm starting to find out as I get older and walk this life that acute liver failure comes from many different causes. So let's jump into this so that because is it a month coming up about liver failure, or is it?
Actually, next month that we're focusing on
Mhm.
for health for the health fair in April does speak about alcoholism.
Okay.
So that was part of the reason why I wanted to just touch on liver,
Mhm.
this project, this particular subject, so that
Mhm.
people have an idea. But alcoholism actually can cause liver failure in general.
Mhm.
Acute liver failure is a little different. Chronic liver failure, cirrhosis, is going to be based more on alcoholism and prolonged use of alcohol.
And so I'm just going, as we talk about it, I would love to hear about uh, the liver transplant. Is that because some people say, well, if my liver go bad, I just go get another one. I think that we also got to talk about, transplants, availability of transplant. If you are just not qualified because of
Mhm.
how badly you've treated your body or your body just won't receive it. So wherever you would like to start.
Okay.
But we do want everybody to know that you can call in at 858-251-6111 if you have any questions. If you're on social media on Facebook, you can actually go to our God Radio 1 page and you can put comments in the section where it's comment and ask your questions there. And if you are on YouTube, go over to Facebook and so that you can do it. We're not monitoring. Matter of fact, we will monitor YouTube this evening also. So, Dr. Fowler.
Okay. Well, thank you for that. So I'm not sure if most people know where their liver lives in their body, but it is in the upper part of their abdomen on the right side,
Mm-hmm.
just underneath, say, the right breast. It is, so your heart in the chest area, your heart is on the left hand side, you have your lungs on both sides, but just below the diaphragm, the liver lives over on the right hand side with the gallbladder below it, and on the left hand side is the stomach. So you need to know where your liver is.
So I always was afraid of being stabbed in the back because I thought the liver was closer to the back. So either the front or the back, if you get stabbed in that area, it'll hit the liver.
Well, it depends on how long that knife is, but
Okay.
but technically, if you get stabbed in the back, depending on the midsection, it could be actually your kidneys that are getting stabbed.
Okay.
Yeah. So the liver is on the upper front part of the abdomen on the right side, with
Okay.
the gallbladder living right underneath it. It does span into the middle part too, but the majority of it is on the right hand side. So the liver, I just need people to know it's a major vital organ that does a lot of metabolic things for our body. It performs lots of biological functions to help support the body. I'm going to go through a list of things. I have my notes so I don't miss anything. So mostly it's going to metabolize things. It's our function for metabolizing things. It does help with our immunity. It helps with digestion, which I'll talk about a little bit. Detoxification. People talk about, hey, I want to detox my body. Well, the liver does a lot of that. So if we do the right things for our body, our organs will function the way how it should. So that's our natural detoxification process. And then it does help with vitamin storage. So those are some of the main functions of the liver, and it is important.
So I'm gonna ask this question, and I know you're gonna be like saying, no, he didn't ask this question. But I have to ask this question about liver and onions. People. I don't know if you might be a little country, little rock and roll, and they eat liver and onions.
Hmm.
But I've always heard that the liver is like a filter, And why would you eat a filter from another animal? Could you help us with that just a little bit?
I'm not sure if I can help you, but it does. The liver detoxifies. The kidneys filter. So depending on what's going on, it
Okay.
can filter things. But there's no harm in eating the organ of another animal. I mean, when we're feeding our dogs, we like to feed organ meat because it has it has more nutrition in it. So I would just say people that grew up on liver and onions, more power to you. Yeah, there's no taboo as to not eating that
Harm in
organ.
eating
Okay.
the
Yeah,
organ.
So you when the liver when you eat a liver of an animal, it's not putting things in there that's going to mess you up in the future.
Not that I know of.
Okay.
But you do need to make sure your things are cooked because you want to make sure there's no bacteria and all kinds of other things from the meat there or the processed organs that you are eating.
Okay.
Yes. So that's no different than eating a chicken foot or a cow's foot or whatever parts. I mean, you eat the insides of pigs and all that. All of those things, you just have to make sure they're cleaned and cooked properly.
Okay. Well, just for the record for everybody, I don't eat no inside of no pig. Praise the Lord. No, I was playing. But I really want to talk about that because as we go forth and we talk about the different organs, especially the liver, is this really to understand the purpose and also how to take care of the liver?
Yeah.
Yeah.
So the importance of it. I mean, it's hard to live without a liver. I mean, we're now having pieces where you can remove some of it and still function, but without a liver, yeah, you wouldn't be here. So just like your heart, there are important organs that do important things in our body. The Lord put us together properly so that everything has its place and its function. So I'll just start off with one of the primary roles, and that is digestion. So, as we eat our food, obviously everything gets involved, and our liver produces bile, and that's a liquid that basically breaks down some of our foods. It digests some of the fats that we're taking in and allows us to process that and store it. The blood that passes through there as we're eating, going through our stomach and our intestine, it does help to purify that. As it goes through, it breaks down and balances out a lot of things in our body. So it is important as we eat that the liver is functioning properly, helps with our nutrients, separating out our nutrients. We talk about medications that we're taking, so the drugs that we're taking in, it metabolizes that to allow it to break down into a form that we can actually digest and use.
Okay, so got to ask the question because y'all told me I had to get on the multivitamin. So the multivitamin, the black seed, and all the medication is broken down in the liver.
It is processed and definitely separated out to pick out the things that are nutritious and can be used. And a lot of times you'll see when you take your vitamin, you'll see your urine turn yellow. So some of it may not all be absorbed and will be passed out in the urine. But for the most part, yes, the liver is separating things out, separating out and using the things that are nutritious and beneficial for our body.
Okay, so the liver is the controller of the color?
Of your urine?
Yeah.
To be honest with you, yes.
Okay.
Because if you have a problem with the bile, so say you have issues, your urine can be very dark like Coca-Cola. Or if you have a pancreatic problem and the bile is not being made, you can actually have stool that's not brown but like paste color. So yes, depending on what your stool looks like, what your urine looks like, determines how your liver is functioning.
Okay.
Yes.
And paste color would be white.
White, beige, things like that, which is not normal. So you'd have to go in and get some lab tests and do some ultrasounds, which I'll get into to determine what's going on in your body.
You mean if you got beige bile, there's a problem?
Yes, there is a problem.
Oh, Lord.
Your stool, the waste of what you eat should come out brown.
Okay.
Yes.
But what is constitution of beige? Because there's different colors of brown.
No, it's not anything near brown. It's going to be more on the clay color, light clay, beige color. If your stools are not your normal brown, they can be black, which will constitute something else. They can have some red in them, which constitutes if you're bleeding or not. But if your stools are not normal brown, if they're a light color, something's going on with your liver or your pancreas. The bile in there is an issue.
'Cause I always thought that if the color of your stool was based on what you ate.
Well, that's to a degree, yes. So if you eat a lot of beets, your stool may be a little bit more red. If you eat more spinach, your stool will be a little bit darker, on the black side. So there are some things that if it's not processed and stored and utilized properly, it will come out in your stool.
Okay.
Yes. So, okay, so now we're going to get into it. Also detoxified the body. So if your liver is not functioning well, you will run into more toxicity or things that are toxins that are going to be remaining in your body and in your bloodstream, causing more harm.
Well, I'm gonna ask because it's Ask Doctor Follow. Everybody be like, "We're gonna detox. We're gonna detox." Can some of these detox hurt your liver?
I don't know what they're detoxing with, I'll be honest with you.
Okay.
So I personally don't think you need the detox if you're eating properly, drinking fluids that are appropriate for your body. Your body's made of water. That's really all you should be eating. Drinking. You can put flavor in your water to make it more palatable if you don't like plain water. But the point is, if you do right by your body, it'll do right by you. You don't really need to detox. I've never detoxified. I'm, knocking on almost 70. So it's like there's no reason for it. God didn't put us together to say, okay, every month you detoxify or one time a year you don't. So these are all things that people promote and people fall into that trap.
The money makers.
Thank you.
Okay, I
Yes.
like that.
So, if you take care of your body, it'll take care of you. If you take care of your car and do its monthly or whatever, every 3 month maintenance, it will take care of you. So there is no magic to making the body function properly. All you have to do is eat right, exercise, drink water, and it will perform the way ours should.
And so while we're thinking about this, because there's this sour stop that people
Sour stop?
Yeah, sour stop that people are using. What is it? Black seed oil or grape seed, something like that. Oil that people are using to help with immunity and everything else of that nature. Are those good things supplements to do, or is that a dependency thing?
I have no idea how some of those things function, and I don't think there's enough studies and research to know how well it works. So I'm going to let them decide if they want to do that. I will say that there are certain natural seeds and things that you can use, chia seeds that help with your bowels and things like that. But to be honest with you, if you just eat enough produce, roughage, your bowels will be fine. You don't have to detox and drink, just whatever smoothies and whatever a day. If you want to detox, you can do something like cucumbers and pineapple and lemon and stuff like that and water. Those are all natural things that helps with the bowels and cleaning out without doing anything magical or going to some corner store somewhere or some spa and drinking something or doing something you shouldn't be doing to your body. I don't know how it affects it because I don't look into those things, but I really feel like if you treat your body properly and respect it, that it will perform for you without any major problems.
Okay. These are questions because, this is what we're impacted with on all social media, online. They're always saying, well, you need this, you need that. And they're so clever because they'll say, and you do this, and they'll show the stools or this, and they say, this is what it looks like. And, when they start talking about detoxing the body, they even have the thing where you can soak your feet in something, and all of a sudden the water turns brown and everything else of that nature. I'm like sitting up here like, okay, now y'all know that's a gimmick, that the water going to turn brown because you done put some electrodes. And so this is the reason why I want to say ask Dr. Afflalo, because as you talk about the liver and as we go through it, there's so many people that think that they're doing right by their liver. But what you're saying is that good data in and good nutrients in is good nutrients out.
Yeah. And there are antioxidants that are natural. If you just look into your fruits and veggies that are deep in colors, in the purples, like the blackberries and the blueberries and the beets and things like that, those are all natural, grow out of the ground or whatever. Those are going to help you with your immunity and detoxing and stuff like that. So if they just do more research on things that are natural versus these products that they have no idea what the ingredients are, they'd be better off. Because down the road, 5-10 years later, we'll find out that that was a problem. You're not going to find out from your natural fruits and veggies, taking them in the proper consumption, that they're going to cause cancer later.
Yeah, and I will say that the other day from an older person, they talked about how they made blackberry wine, and I'm like, blackberry, yeah, you put your cheesecloth in there, and you put the blackberries in, and then you put some sugar in. I said, do you put no water in? No, you don't put no water. And you just put it underneath your bed. And a couple of months later, you come in and you got blackberry wine. I said, what? Well, all right. But wouldn't that, the wine, once it's fermented, does that have a negative effect on the liver?
I'm not sure about that, but obviously they used to, your moonshine, you make from natural things, rice wine, things like that. You use your basic product, and then from that it ferments. For the most part, I think it's fine. I don't promote wine anyway. But the point is it's, if you're controlling what's in it, then you probably have better control about what it turns out to be.
Okay.
So with that, I'll just say that here are some of the things that you can look for if you're concerned about possibly having acute liver failure. So acute liver failure basically means that the liver cells in there are now damaged and are unable to function and perform all the duties that I suggested. They can't detoxify, they can't actually, help with immunity, can't metabolize things. So it's not functioning, which is going to make your body have some symptoms. So here are some things that you can look, and acute liver failure can happen in a few days to a few weeks. It comes on pretty quickly.
Oh, wow.
So the things I'm going to read through, you might want to pay attention to, and if they're coming up out of nowhere, you might want to obviously go ahead and be checked out because it can be life-threatening, an acute liver failure. So some of the symptoms you might notice is all of a sudden your skin, some of us can't tell if our skin is yellow, but if our skin turns yellow or the whites of your eyes turn yellow, jaundice. That's a sign that your liver is not functioning well.
Okay, Dr. Afflalo, I got to ask you, what's jaundice?
Jaundice is a yellowing of the skin, or yellowing in general. It has to do with the bile also, but and your liver function. So I'll just give an example. Anyone that has anything related to their liver, sometimes, and I'm going to talk about some of the other symptoms, is the first thing they'll see, because for black folks, it's a little hard to see the yellowing hue in your skin. But if the whites of your eyes are turning yellow, you do need to go and seek help. So it is a yellowing. Okay. And I'll tell you about a little bit more about the other symptoms that come up with it. So it's not, yelling of the eyes, you should go and get checked because that's not normal.
But so all them weed smokers out there, their eyes start turning yellow, is that a sign that their liver is starting to fail?
Well, I don't know if their eyes turn yellow or do they turn red.
No.
They turn yellow?
They
Then
turn
they should
yellow,
go and
yeah.
get their liver checked.
Okay.
Yeah, I guess I'm not around enough weed smokers to know. But if you have pain in the upper right abdomen, just out of nowhere, it could be your gallbladder, but your liver is there too. So if you're having yellowing of the eyes or skin and you're having pain in the right upper quadrant, upper part of your abdomen, concerns are going to be the liver. If you have a swollen belly, all of a sudden your belly's swollen and it's kind of filled with fluid, that's ascites, fluid in your belly. Collecting, that's from your liver failing and not being able to process things. The fluid just starts backing up in the system. And they usually have to tap the belly, put a needle in the area, and draw out the fluid, right? So depending on what the ascites is from, it can be from cancer. And I'll just give an example. My mom had pancreatic cancer. Her skin was yellow, her eyes were yellow, her belly was big like she was 12 months pregnant, and they had to keep tapping the fluid. That was from the liver failing from the pancreatic cancer that was in the liver and the pancreas. But you tap the liver, and the ascites, you drain it down, you feel more comfortable because you don't have this big bloating, all this fluid on your organs. But it just comes right back because the problem is the cancer continues to produce the fluids and the liver is failing. So ascites is not a good thing. It's not fat, it's fluid in the entire abdominal area. Okay, so just think about it. It's not one isolated thing. When your liver is failing, you're going to have multiple of these symptoms that I'm mentioning. You'll get nausea and vomiting, and that's not from being pregnant or from being whatever. It's like if you're having these other symptoms and you're nauseated and vomiting, it's probably going to be some kind of liver problem. If you're just feeling kind of not well, overall not well, okay, not related to flu. If you know you have another symptoms and you're tired and you have malaise or fatigue, it's from the symptom you're having. But if you have some of these other symptoms, plus you're feeling just dragging, malaise, feeling unwell, that's probably another symptom of your liver not doing well. You will get some fluid backing up into the brain. That will cause pressure in the brain. It will also cause disorientation. So if all of a sudden the person you know or yourself is starting to get disoriented and confused and or having seizures, there's some fluid going on in your brain that's pressing on some vital areas. That needs to be checked out, especially if it's associated with ascites in the belly, fluid in the belly, and yellowing of the eyes. Also personality behaviors, things like that. Your personality changes, your behavior changes, all part of the symptoms of the liver acutely shutting down on you. So it's a very important organ. You'll start getting more drowsy. You'll find it might be more even difficult for people to wake up. And interestingly enough, they might have a sweet or a musty odor to their breath. We're not talking about a halitosis. We're talking about they might have a sweet breath or a musty odor to their breath. That certainly can be an indication. And then tremors out of nowhere. So it's not it's not tremors from essential tremors or Parkinson's. It's tremors associated with some of these other symptoms related to your liver failing. So those are some of the signs that you can look for, signs and symptoms, that if you're having any one, two, three of those, please go and see your doctor so that you can be evaluated to determine if your liver is failing. You don't have a big window of opportunity. You really need to be evaluated so that they can try to reverse some of the things that may have caused it. Let's talk a little bit about what causes the liver to acutely fail. So you're going along minding your own business and all of a sudden you start getting these symptoms. What happened? Well, some people deliberately take an overdose of Tylenol because they're trying to commit suicide, but it will definitely affect their liver.
Okay, well now folks, Tylenol's the painkiller of choice. So let's talk about this Tylenol
Yes.
and the liver function. Because I use Tylenol and you done made me nervous.
It's okay to use Tylenol in moderation and how it's suggested or the dose. So we recommend, because they come in different doses. They come in a 325 and a 500 and a 650. We recommend no more than about 3,000 milligrams a day. So if you take a 500 milligram tablet, you can take 2 of them 3 times a day and be safe. When we're talking about Tylenol overdose, when you take a whole handful and drink some alcohol because you're trying to check out, okay, that's toxic to your liver, and that's what's going to start failing. So it's a Tylenol overdose, not a Tylenol use. Use in moderation is going to take care of your pain, and you respect it, it'll respect you and your body. So outside of that particular drug, there's also, and that is actually the most common cause of acute liver failure in the United States, is Tylenol toxicity. And so I don't know if people are using more because they're having more pain and they can't take something like a Motrin or a Naproxen or something like that, or if they're deliberately trying to harm themselves. Because that was one of the most common things. Just take a handful of Tylenol and drink some alcohol, and then you're not there anymore. Someone will find you with this bottle empty next to you. So that is the most common cause of acute liver failure. Hepatitis. Hepatitis is an inflammation of your liver, and it can be caused by various viruses. So you want to make sure that you test for those viruses to make sure you don't have them. Hepatitis A and B are the ones that we can get vaccinated from or to protect. A tends to be what we call fecal-oral transmission. That means that you don't wash your hands properly, and then you go and manage your food, and if you happen to have, or someone manages your food, and they happen to have hepatitis A, you will get hepatitis A. Do you remember the outbreak that we had back downtown with a lot of the unhoused homeless population, hepatitis A? And that's because they have nowhere to go to defecate, and then they have nowhere to clean themselves up, so they have this fecal-oral transmission, and then they started getting, and then it spreads. Right? And so they had to go downtown and wash down the streets, move the people that were unhoused, wash down the streets, kind of quarantine the area, try to vaccinate all of them with hepatitis A who didn't have it, vaccinate them so they prevent them. Because you can end up in the hospital with acute liver failure and die from it. And a handful of I don't remember how many, but a handful of unhoused populations, they did die from hepatitis A during that pandemic or epidemic that we had here in San Diego. So it's not a mild thing, and we have to be cautious about it. And then they started telling people to go and get their hepatitis A vaccine to prevent us from getting it, right? So you can pick that up from an eating establishment. If someone happens to have hepatitis A and they're handling your food, they go to the bathroom, of course, nastiness, they don't wash their hands, and then they go and start handling your food again, no gloves on, you very well stand the chance of picking that up. There's several other viruses that can cause it. You don't really need to know all of them, but the Epstein-Barr virus, the cytomegalovirus, there's a herpes simplex virus. A lot of viruses can affect your liver and cause it to stop working. There are other medications, prescription medications, that can affect your liver if not taken properly, and that are antibiotics. Some of them, processed through the liver can, affect it. So we have to be mindful and also pay attention. So you don't want to not take an antibiotic, because the likelihood is not going to cause you problems unless you're not taking it properly. Okay, I missed 2 doses. I'm going to take 3 right now. You don't do that. You don't make up for lost doses, because that can cause problems. Anti-inflammatories, non-steroidal anti-inflammatories, those are your medications that help with your arthritis and pain. So your Motrins, your Naproxens, your Advils, your Aleve, those types of your meloxicams, those are the ones that can affect the liver if not taken as prescribed. And then seizure medications. Anyone that's on a seizure medication does run the risk, if depending on their body and how their liver is processing, to affect their liver. So there's a lot of things out there that can affect the liver. We just need to take them as prescribed. Try not to add any extra supplements on top of the medicines you're taking because we don't know how they interact. That might be what tips you over to having your liver affected.
So let me ask you a question. Is there hereditary liver malfunction that your family have liver issues?
Not that I know of. I mean, there is an autoimmune liver disease, but that's yourself turning on itself. So your immune attacks itself. Mm-hmm. But I can't think of anything offhand of a hereditary liver problem.
Okay.
I'd have to go back because, I'm old and forgetful. But I can't think of anything offhand, and I can't remember taking care of any patients in a hospital that had a hereditary type of, it would be like a hepatitis, some kind of a liver function problem. Obviously, there's a lot of herbal supplements that we don't know anything about. They do promote them, the ones that want you to take this, and that. On the TV, they'll promote a lot of things. We don't know what's in them, and there are certain herbal supplements that can cause your liver to have some problem. I have some down here. I've never even heard of them or seen them. Kava, ephedra, skull cap, pennyroyal. I don't know what these things are, but there are some things, they're probably mixed in some of the other supplements that can have the potential to cause your liver harm and damage your liver cells. So keep in mind that supplements aren't necessarily without risks.
Okay.
Yeah, they're not. There are toxins. So you think about, some people are now talking about eating mushrooms and stuff, but there's certain mushrooms that are toxic.
Yeah.
And they can affect the liver.
Yeah. And so, because you see all this on the king mushrooms and all these different mushrooms, taste just like chicken, all the other stuff, but they're not also telling you some of the harmful effects that when you think you're doing right, it could actually be doing more harm.
Right.
Than good.
It can possibly be harming your
So
body.
I'm going to ask the question, I don't know if you're a sushi lover.
No.
Okay. I love me some sushi as long as it's cooked.
That's not sushi then, because I was just going to say I don't eat anything raw like that, unless it's a fruit or a veggie that's supposed to be eaten raw.
Yeah,
so you like a sashimi type of thing.
Yes, but California roll, everything.
Oh yeah, that's not a real sushi.
Well, no, don't say that, because I still use those chopsticks and I put the same stuff on it. But let's talk about it. Can you, by eating certain foods that are undercooked, could you ultimately start affecting your liver?
You can just affect your body, because it can affect other parts. You can get a GI problem where you will have, things can shut down, or they can just go right through you. If you don't tolerate them, they can go through you, but they can also have toxins. I mean, we know that tuna and other things in the sea have a high level of mercury. So we have to be careful how much of that we eat, and we warn our pregnant moms not to eat too much of that type of a fish, because the mercury can start poisoning us. So there are things that we're not really sure of, or we haven't measured how much of this will now start causing toxicity. Everything should be in moderation. I don't know, and I do know that you can get amoebas and other types of infections from eating raw fish. That's why I tend to stay away from it. And I don't care how much people tell me it tastes good. I'm sorry, it needs to be cooked. Yes, it can cause problems. I don't know if it's specifically just liver, but it can affect your GI tract and other things. So I'm sure the liver is involved in the processing and metabolism of it.
Okay. Now, dialysis.
How do you get to dialysis?
Well, because I was going to ask the question, dialysis is for the kidney?
Yes.
Okay. So if you have a bad liver, dialysis still won't help?
No, because dialysis is basically to process the toxins that's within your system, because your kidneys aren't filtering it. So it's all backed up. And so dialysis is really for the kidneys to help support removing the toxins that have backed up in your system and the extra fluid that's causing. So there are two different organs functioning in two different ways. When we get to our kidneys, we'll talk about dialysis, and we have mentioned it in one of the shows before. It is truly from most of the people in a dialysis unit If you walk in there to 10 out of 10 of them, there's going to be mostly people of color, black and brown people, because you tend to require dialysis because of kidney failure, which stems from chronic blood pressure and diabetes that's poorly controlled. And over time, your kidneys fail. You get chronic kidney disease, and they no longer function properly to filter. And then if you do not get dialysis after a period of time, you die. So that's why people need to be on dialysis either every day for several hours at home, 12 hours, or 3 times a week they go to a dialysis unit and get, dialyzed that way. So it is important that your kidneys function properly, which means that you need to take care of your blood pressure and diabetes and everything to control preventing failure of your kidneys.
Okay.
Because it leads to a chronic problem that then leads to, you're on dialysis for 10 years and hope that you get a kidney. Most black folks die before they get a kidney. The lucky ones get one, and hopefully they to take care of it so that it gives them some longevity. But that's for your kidneys.
So let me ask you this question. From a child into your older, what are some of the red flags that parents should keep in mind as they're raising their children to have a healthier lifestyle, but also to be concerned about for the liver function?
So, to be honest with you, if you want to be a good parent, try not to give your kids things that have preservatives in them. Because over long term, we know it's going to cause some harm. Some things cause cancer in certain cells and certain organs. So and I know it's hard because our parents in our communities work 2 and 3 jobs. So they don't have time to cook unless you're going to, meal prep and do a lot on a weekend, right? But what we do is we drive through somewhere and we get something that's quick, that's processed and fried, and then over time, our kids are now getting diabetes at an earlier age, adult onset diabetes at the age of 10, because they're now carrying extra weight, and their pancreas is making insulin, but the body's not recognizing it to that point. So we now have to give them medication, which is sinful at that age. Avoid giving them beverages that are loaded with sugar. Sweetened beverages are not good for anyone, but especially our kids. So water, or infuse your water with some fruit or some melon or some mint or whatever, cucumbers. I don't care what you put in, as long as it's natural. Slice it up, put it in their water, but try not to stay away from the processed foods and all the additives and preservatives. Like they say, the colors, the dye colors are affecting our kids and everyone. So if we can stay as close to natural, grown out the ground, off the tree, pick off the tree, pull off the ground, and process and cook it that way, we're much healthier. Our organs will be a lot healthier. So for the parents, I'd say as much as you can, try not to do the drive-by. Maybe just take a day and help your kids have the kids come in and help you prep, chop up the fruits and veggies and prepare them, and then have your meals prepped so you can just take that out and eat it. Come back and fix a couple casseroles, freeze them, and then come back and, heat them up for dinner that evening instead of driving through drive-through and bringing some fast food home for your kids. You're not doing them any favors. So if they're not learning well and they're having issues and weight issues and concentration issues, think about what we're putting in our bodies.
Yeah, I'm trying to. I have an affinity for Chinese food. And
Wait, last time you had an affinity for Popeye's chicken. You've changed your affinity now?
No, remember, Popeyes make me sick now.
Okay, good.
So I haven't had Popeyes in over a year.
Okay, good. But now it's Chinese food.
Yeah. Well, no, I like brown rice.
Okay.
I like brown rice, and I like when they have the stir-fried vegetables and every now and then have a little shrimp or something in it. But I like the brown rice, the vegetables, and a little protein. And when I have to, when I'm on the run or anything else of that nature, that's normally what I'll try to get. All the other places don't have it, or I'll find a place that has a salad that has a vinaigrette dressing or something of that nature. So there's a way that you might use fast food, but it's fast, but you want to get fast food that is going to also be healthy.
A healthier choice, yeah. Yeah, you can get salads, and you can, bring your own tote your own little thing of dressing that you want to do. But yeah, you can also meal prep so that if you like a lot of brown rice, make a whole, 2 cups, 3 cups of brown rice, stir fry your veggies, and then have your shrimp, and then make your little bowl and take it with you, right?
Yeah.
If you're somewhere that you can warm it up somewhere. But those are the things that I mean when I say meal prep. But yes, if you're on the go all day and you don't have time to do that, a better choice. Yeah, so if you have to drive through, there are some salads and things like that. If you're going to have chicken on it, make sure it's grilled and not fried and breaded and fried. And make sure you get a vinaigrette dressing, something you can see through that's not, whatever you call it, creamy and all that stuff.
So I know we're talking about the liver.
The liver.
But I did want to say to you, the air fryer is an amazing invention because you can take those little breasts and put it in there and season it up and it will taste like grilled chicken.
Yeah.
And so I done pulled my air fryer back out, and when I feel like I need some of that protein, I season it up and put it right on in. And now they got seasoning that's called non-salt. And this has different herbs and spices. And I feel like I'm a gourmet.
Gourmet. Yes, you are a gourmet. You can easily prepare healthy meals at home. You just need a little bit of time. That's why I'm saying take a few hours on a weekend and do a full prep for the week. And then you can portion them out into your containers and have it so you can grab it and go. And so, yes, air fryers are good because you don't need any or very little healthy oil, an avocado oil or an olive oil or something. But you'll make your stuff nice and crispy how you like it without breading it and frying it. So, yes, that's a good option for you.
All right. What more should we know about our liver?
Liver. Okay, I'm still getting along here. So some of the causes. We've gone through some medications, some drugs, hepatitis, some viruses, some herbal supplements, some toxins.
Can I ask you a question? Hepatitis A. Isn't there hepatitis A, B, and C?
Yes.
So do all of them affect the liver?
Yes.
Okay.
So hepatitis A and B can be more acute. They are hepatitis A, like I mentioned, and I didn't go into B and C. A is more fecal oral transmission. That's what we talk about when in the medical field. Fecal oral transmission from your body, from your bottom to your mouth is where the virus transmits. And that's somebody handling, usually with food handlers, preparing your food or you yourself, and then getting hepatitis that way. B tends to be more when you're exposed to someone that has hepatitis B and C with that has, if you are exposed to their blood or their bodily fluids. Okay. So we talk about things like sexual contact, right? You should be wearing condoms. If if you mix your bloods, like for us in the universal precautions in the hospital, we need to wear gloves and masks and things like that when we're in somewhere where blood is going to be all over the place. You don't want it anywhere. If you accidentally stick yourself with a patient's needle, that you have to report that to your organization. But yes, needles. So if you're out there doing IV drugs and you're sharing needles, you're at risk. If you're going to a tattoo parlor that's in the back alley somewhere and it's not a reputable place that's safe and clean, you run the risk of not having a sterilized needle that can then can give you hepatitis. So needles, exposure to blood that's tainted with the hepatitis virus, or bodily fluids, those are the things that are going to put you at risk. And so that's B and C. Okay. And so, yeah, the folks that tend to want to meet up with somebody and get together with them and have sexual intercourse and don't have a condom, you put yourself at risk for everything that they have. Hepatitis, HIV, herpes, you name it. Whatever they have, you have. Whatever their last 10 partners have, you have. So you should always protect yourself that way.
And that's what, from a spiritual standpoint, I always say, how they say soul ties. But I always try to say when you are integrating with someone that you don't know and you have not did what they call the couples test and all the other things, you really expose yourself to the legion. And they said, in the Bible, the legion is spirits, multiple spirits. They said, who are you? We are legion. And so many times we don't realize that when we expose ourselves to people that we don't know, we just are physically attracted to them. We are opening ourselves up to, like you said, not only to what they have, but whatever the 10 partners or so that had before them. So really, you when you make these soul ties, you are introducing yourself to legion that could actually affect your whole entire system.
Absolutely.
Yeah.
Absolutely. Yeah. Amen to that one.
Amen.
So, and one other thing people may not think about it is you can, from a heat stroke, when you're out there doing some physical activities in a very hot environment, that can actually trigger an acute liver failure. So not all the time, but most people get heat strokes, and then we hydrate them and we do whatever, cool them down, cool their inner body temperature down. But it can trigger acute liver failure, so keep that in mind.
Now, here's a question. They want to know, of the hepatitis A, B, and C, which one prevents you from donating blood?
C and probably B.
Okay.
Yeah.
All right. And so C and B are B and C.
B and C.
Okay, very good.
Yeah.
Yeah. So we're going through it.
Yeah.
I want to get everything, because the last time when we talked about the GI tract and the digestive tract, boy, I got questions after that. People start calling and say, "Did you say this?" And I say, "Yes, y'all better stop all this new things y'all seeing on social media. It will cause you, I said have some what is it? Some outcomes that you didn't expect."
Right, right. Absolutely. Yeah, I just don't believe in the hype. So if people could just turn off all the social media and stuff and not take it in, if you just want a little entertainment, but don't believe all the stuff you say, because it's all sensationalized and they're just trying to capture you and lead you down a path that's not going to be good. So, so let's go with a little bit of complications. Okay. So if you do have acute hepatitis, you have acute liver failure, it is an urgent problem to go and seek help, because, like I said, cerebral edema, you can have your brain swell, you can have extra fluid inside your skull. The skull does not move, so if you have fluid collecting there, it's going to end up pressing on some vital areas in your brain. It can cause, like I said, the disorientation, the confusion, and seizures. It also, because the liver produces some specific things, it can cause a bleeding problem. So if your liver is failing you, your liver is now not able to produce enough of a product, a clotting factor. A clotting factor is what helps you clot so you don't bleed to death. I mean, we need to clot. We don't want to overclot, because then you run the risk of strokes and heart attacks. But we have platelets, we have prothrombin, we have a lot of things in our body that allows us to clot. So if you cut, you can put some pressure on it, it'll clot. And if you cut yourself, put some pressure on it or whatever, it'll finally clot. You have clotting factors come there, and then it'll stop bleeding over time, right? So if your liver stops making the clotting factors, you now just bleed and bleed and bleed. And then you can see how that would be harmful. So
let me get it. So is the liver the source of clotting, or?
It produces some of the clotting factors.
Okay.
Plus our blood cells, our complete blood count, we have white cells, red cells, a bunch of other things, but we have platelets. Platelets also help to clot. Okay. So the liver is very important in producing some clotting factors that are necessary to not have us bleed out.
Okay. So let me ask you this question before I go on. I remember you saying that if you're trying to stop from bleeding, did you say that you put some ice on it?
No, I said put pressure on it.
Okay.
I mean, you can put ice too, but pressure for sure is what's going to kind of prevent the bleeding from continuing, and then it eventually give yourself an opportunity, the body an opportunity to get the clotting factors there to stop the blood, to clot where it's where you
ice
cut.
don't help, because and I'm gonna tell you this because I've tried different things. I've tried ice, but sometimes when you have a bleeder, back in the day when I was on blood thinners, I actually would use alcohol and hold it pressure there, and it seemed like the alcohol and the pressure stopped it. But if I just did pressure without the alcohol, it would never stop bleeding.
Oh, that's interesting. Okay.
Yeah. So I'm wondering, what things they should do, because when you're at the doctors, they have what they call a pin or a little stick they can stick in.
Well, we have the nitrogen stick. No, that's what it's called. It's called something that actually stops the bleeding. It's called I can see the stick right now because I use it on the patients. When we have a little bleeder, we just put it on there. Silver nitrate stick.
Okay.
Silver nitrate stick. It looks like a big match.
Yes.
And you just put it on there. It does sting and burn, but then it forms a nice brown thing, almost like a scar or a scot, a silver nitrate stick. I was going to say something about the clotting, but because ice can work to some degree, because it constricts the vessels.
Okay.
Right? So whatever is bleeding out there can help. The pressure is most important, because when you say you're out in the field and you're bleeding, you put a tourniquet on above the area so you can stop the bleeding, so somebody doesn't bleed out until they get to the hospital. I don't think ice alone would help something like that on a major artery, but pressure does, right? When you see somebody with a gunshot wound, the goal is to get, take the shirt off or whatever, put some pressure on there and hold on to it until you get them to some place where they can stop the bleeding so people don't bleed out. So bleeding is definitely an issue if your liver's failing.
Okay. So I do need you to take a up at the screen because there is a question and that you might be able to talk to her about.
Okay, so I see where it says this person's sister's in a hospital suffering from acute liver failure due to excessive alcohol use. 64 years old, not preparing for hospice care. Yeah. So acute liver failure with alcohol, it could be acute on chronic because alcohol, depending on how long they've been drinking, can be a chronic liver disease with cirrhosis, but then you can have an acute on chronic, meaning all of a sudden now it's that little bit of function that they had has now failed them. So if they have acute on chronic, it's very hard to replace or to repair that. Most of the time, acute liver failure, we try to reverse what caused it, right? So, and I'm going to get to that in a minute. But the point is that if there's no cure, if the liver has failed completely, it's cirrhotic, it's like a piece of rubber, and you cannot revive that, then yes, preparing the person and the family for hospice, for palliative care, which is comfort care, makes more sense. So it depends on how much damage has been going on. It sounds like acute liver failure from alcohol must have been either, if there was no long history of alcohol abuse or use, then it could have been just a massive amount at one time, right? So a binge that could put them into acute renal failure. And then if there's no way of reversing the damage on the liver cells, then yes, there's not much we can do. So, just ask all the proper questions to the physician that's taking care of your sister and see if there's any way that whatever damage is there can be reversed at all. And if there isn't any opportunity because it's been chronic over time and no one really knew it, but now there's an acute issue that brought her into the hospital, then acute on chronic, there's probably not much they can do, unfortunately.
So my question is, if you have liver disease or this situation, who gets liver transplants?
Well, funny you should ask that because it depends on a chronic liver disease person may not be at the top of the list because especially if they did alcohol use and abuse over time and they cannot change their behavior, we're not going to give a healthy liver to a person who's going to damage that healthy liver. I will give you an honest example, a personal example. My niece was killed at the age of 12 in a car accident. We harvested and donated all her organs. A young gentleman, he was about 24 years old, in the military, had hepatitis at UCSD in Hillcrest, and his organ, her liver, her 12-year-old liver, was donated to him so that he could live. So his hepatitis was not self-induced, right? So he had a fighting chance of getting a healthy liver to be able to live a full life. We're not going to give a healthy organ to a 80-year-old that doesn't have a longevity. Mm-hmm. We're not going to give it to someone who has other chronic diseases like another cancer because we want to save the healthy organ for someone who will have a little bit longer life, right, and a healthier life. But if you've got other chronic medical conditions that are not well controlled, then you're not going to take care of that healthy liver we're going to give you. Mm-hmm. So there is a priority. I don't know all the rules and criteria and stuff like that, but you do have to have a match, so that you don't reject the liver. This young military guy had rejected the first liver, and he was still in the hospital. So he got my niece's liver, and so it gave him an opportunity to have a normal life after that. So there are criteria that needs to be met, just like getting a kidney transplant.
Okay. All right. Let's move forward in the rest.
So we've got a few minutes. Also, one other thing is you can get infections from having acute liver failure. So we do need to keep that in mind. Prevention. So let's talk a little bit about how we can prevent that. Obviously, the things that I said can cause it are the things that you try to avoid. So taking your medications properly, like the acetaminophen, don't take in, if 2 helps and 4 will be better. No, don't. That math does not add up when it comes to your liver. Making sure that you follow your physician's or your provider's instructions on, medications plus supplements. They don't necessarily mix sometimes, depending on if we don't know what's in the ingredients in the supplement. If you, I don't promote drinking at all, but if you do enjoy alcohol, the recommendation is only 1 drink for a woman and 2 drink for men per day.
Okay.
Yeah. So when you guys decide you want to not drink during the week but have 6-pack on the weekend, that's more than 2 drinks for the men. That can really just set you off. So it doesn't make sense to not drink and then binge on the weekend. If you like the taste of alcohol and you want one, I would not suggest more than 1 drink per day for a woman and 2 for men because of the body mass and how much they can tolerate and metabolize and process and get out of the system.
Well, Dr. Afflalo, I don't drink that brown liquor, and I don't drink that clear liquor. I drink the fruit of the vine, the vino, and I heard that it was healthy if it was red.
Mm-hmm.
You know.
Alcohol is alcohol.
Okay, so hello,
Yeah.
alcohol is alcohol.
Yes.
All right, and it doesn't. So you're not even talking about toxicity, or like say for instance, like they say the brown alcohol versus the wine. It still has the same effect.
It's going to have the same effect to the organs in your body. Like I tell people with diabetes, your body does not know if you're eating a donut, a Snickers bar, or a smoothie from Jamba Juice that has 2,000 calories in it versus a fruit. I mean, if sugar is sugar when it comes to the body. It's the amount that you're taking in and how it's processed. So alcohol is alcohol. There's not one better than another. Whatever it is one. If it's one shot, it's one shot. If it's got a little chaser to it, fine. Or if it's on the rocks, fine. I don't care. The recommendation is if you must drink or you like drinking, 1 drink per day for a woman. That's how much your body can metabolize healthily, and 2 drinks for a male.
Okay.
And then, of course, avoiding the risky behavior that puts you at risk for getting hepatitis and causing your liver to fail. Avoiding illicit IV drugs. That's the needles that can put you at risk for hepatitis. Sharing needles, using condoms. We talk don't smoke. Avoid people's body fluids and blood and all the other swapping saliva. So in other words, don't share toothbrushes if you don't know the person. And don't share things like razors and stuff, because if they nick themselves and they have hepatitis and you go shaving yourself, you could easily pick that up. So sharp objects, blood, bodily fluids should not be shared.
So, ladies and gentlemen, that also means that you're going to have to be very selective with your manicurists, your pedicurists, your barbers, your salons, because you can literally get it from people not properly cleaning their utensils or their tools that they're using.
And then if they break your skin,
Yeah.
right? So absolutely, anybody that's coming anywhere with something that's sharp that can, break the skin and cause infection to get in there, you should avoid that, or at least make sure they're taking out new tools or wiping down with alcohol their tools, their equipment. Yeah. And then maintaining a healthy weight, because believe it or not, there's a lot of people walking around what we call a non-alcoholic fatty liver disease, and that can put you at risk for the liver failing. So when you look at on an ultrasound, you see a liver, but you see a lot of fat around it. That's not healthy. Or if you see, like with meats, if you see your meats all marbled up with fat, that's not necessarily a healthy thing, right? It may taste better, but a fatty liver is not a healthy liver. So we want to keep the weight down and avoid fat with that.
So I'm going to ask you a question. How can you find out if you have a fatty liver? Can you go get tests, or is that a specialized test that you have to holler and scream before they do?
No, but I'm getting to that. Okay. That's my next point, so hold that thought. The last thing I'll say is, in order to help prevent things, is get vaccinated for hepatitis A and hepatitis B, so that it prevents you from getting infection. Hepatitis A, I believe, is 2 vaccines, I think 2 months apart, and hepatitis B is 3 vaccines, 1 or 2 months apart. Anyway, they'll tell you what it is. I can't remember the schedule, but you can get the series of hepatitis B. When you're diagnosing, so if you're not sure that you have any liver problems, your routine annual exam with your provider should include basic liver function tests. LFTs, we call them, liver function tests. And it should have several liver enzymes and things like that. That's your first step. If all your liver enzymes are normal, they really don't need to do much more. If you're taking certain medications that may increase your liver enzymes, like some of the statins can increase your liver enzymes, we'll check it at least once or twice. And then if it doesn't increase after you've been on it a while, it's not going to increase your liver enzymes. So those things would be the test. If for some reason your enzymes are elevated, then we have to go searching. We are going to ask a history of, are you drinking alcohol? Are you taking this? Are you doing that? To see what's causing it. But the next thing is to do an ultrasound of your liver to see what it looks like, and or a CAT scan and or an MRI, depending on the patient and the history of whatever else they have. So the next thing after blood tests, if they're elevated, is to actually look at the liver. And then the last thing is if the liver looks healthy but the enzymes remain elevated, because we'll recheck them. If they're still elevated or getting higher, we need to biopsy that liver. Take a sample of it and see what's going on, what cells are in there. Hepatitis C puts you at risk. Chronic untreated hepatitis C puts you at risk for liver cancer.
Okay.
So we want to make sure that you're not developing things like that. All right. They've come a long way. They now have treatments. So there are treatments that are out there. I don't know all the details on them, but I know some of my patients in the past have had treatment, and then their hepatitis C has been reversed. And decreases your damage and avoids the risk of transmitting it. So there are things that are good in research. That's the reason why now it's unfortunate with our current administration that we're taking away all the research, because research is good and it's progressive to allow us to get treatments and things for things that people are dying from that may not have to die.
Okay.
Yeah.
Good. Well, now you said that I had to wait and you had the answer to the question.
Yes, and that is getting blood tests. It should be done annually or more often if we see a slight elevation or if you're on a medication that puts you at risk for it. I will take this moment to, I was going to say treatment. So treatment basically is there are some medicines if you're poisoned, can reverse the poisoning issue that's causing the acute liver failure. Mm-hmm. Liver transplant is one which we spoke about. Obviously, if you have extra fluid on the brain because of the fluid, we can actually relieve the pressure in the brain to not cause more harm and cause more seizures. You can put a shunt in there and drain some of that fluid. Screening for infection to treat the infection so we can reverse the acute liver failure. And preventing severe bleeding, obviously, vitamin K and things like that. There's things out there. And then providing nutrition support. So there's a lot of things we can do if we catch acute liver failure early and get the person to the hospital as soon as they can.
Well, Dr. Afflalo, you have given us a lot to hear and to abide by. Thank you for answering our listeners' question, and thank you for giving us your time once a month so that we can ask Dr. Afflalo. I want to end off by just encouraging everybody, if you like how Dr. Afflalo does what she does, we want you to go check out IWC Primary Care. They are our choice for the services of meeting our health needs. And also, there's a upcoming health fair.
Yes, so the health fair is held at the Jackie Robinson YMCA the first Wednesday of every month from February to December from 10 to 3, and there's a lot of services out there. The ones that are obviously most important to us is making sure people come and get their blood pressure, their diabetes, their cholesterol, and their A1C checked. It can be screened right then and there. You get the results, so we can then have a discussion with the provider there, nurse practitioner, physician, to tell you what your risks are. But we do have food distribution. We have a new vendor there, free eye exams and glasses, along with dental and some other things. So come check us out. We have a lot of free services out there. It's a one-stop shopping for your health needs. Come on out, first Wednesday of the month. We'll be there next Wednesday, April 2nd from 10 to 3.
And I do want to let you all know that Dr. Afflalo, when we were doing the MLK celebration, I don't know if I was coming over to have some sweet treat or what, and she said, you can't get what you're getting until you get your blood sugar tested. I said, I'm good. She said, oh, I'll tell you if you're good. And then after she tested, she said, oh, yeah, you are good. You can have that. and so it really is a non-threatening environment, and you will see the love in the healthy direction that they are providing every first Wednesday of the month. So stay tuned. We're going to have more information, but we're going to end off with just a little advertisement. Y'all have a blessed night.
Are you seeking personalized medical services that prioritize attentive listening and addressing the underlying cause of your health issues? IWC Primary Care, part of the esteemed Sharp Community Medical Group, has opened a new clinic in Spring Valley. Our mission is to provide high-quality medical care in a compassionate and patient-centered environment. We are providers who listen and providers who care. IWC Primary Care Clinic is located in Spring Valley at 10225 Austin Drive, Suite 105, conveniently situated in the same building as Sharp Care. We accept all Sharp health plans, as well as most major insurance plans, such as Medicare Advantage and commercial plans. IWC Primary Care, a Sharp community medical group clinic, owned and directed by Dr. Suzanne Afflalo. Visit our website, iwcprimarycare.com, or call to book an appointment, 858-648-0755.